What I would interpret is just a disregard for the law.
Despite being required by law, 22% of opioid prescribers in Arkansas are not registered with the Prescription Drug Monitoring Program. This, according to the Arkansas Department of Health's 2017 annual PDMP report.
The law was intended to make everybody accountable, that if you're in the chain of issuing or administering controlled substances, that you step up and do your part.
State Representative Kim Hammer was one of the bill's sponsors. Now that it's law, prescribers are required to check the PDMP before writing opioid prescriptions, and pharmacists are required to report any opioid prescriptions that are filled.
I think, for one word, I'm disappointed.
Kirk Lane is the Arkansas State Drug Director. A big part of his job has been tackling the opioid epidemic that is crippling our state.
I'm disappointed because we worked hard to pass this law, and the intent of this law wasn't to limit prescribing, but was to give good information to a prescriber to make a good prescribing decision.
Arkansas has the second highest opioid prescribing rate in the country. Hammer says if the check isn't happening, patients in Arkansas can still doctor shop. Members of 5 boards have access to opioids and are required to use the PDMP, the medical, pharmacy, dental, nursing, and veterinary boards. Lawmakers intentionally cast a wide net.
Maybe they're going to the veterinary clinic and they're getting a prescription for their pet, when in reality they're going to use it for themselves.
Each board was required to present before the Arkansas Legislative Council July 3rd. In those presentations, they were expected to explain how their members have utilized the PDMP and how they're working to bring the prescribing rate down.
It's been a valuable tool for our board.
According to the information presented to the ALC, the Pharmacy Board is the only one that has issued disciplinary action against those who don't properly access the PDMP.
I outlined 2 different cases we've had where we found there were pharmacies or pharmacists failing to submit those reports. Both of those pharmacists are unable to practice at this time.
Shame on them. This is about dealing with unprofessional conduct in violation of state law.
For instance, the nursing board encourages those found to be misusing scheduled prescriptions to seek treatment. But they tell me they have no disciplinary matrix in writing that says if you do this, this will happen. The Arkansas Department of Health is required to issue report cards to prescribers, letting them know how they're doing when it comes to overprescribing and using the PDMP system. According to the medical board, they will not receive copies of the report cards unless provided by the physician. If there are concerns about prescribing habits and there's been no response from doctors, the board will then get a copy. The earliest that could happen is spring of 2019, leaving me wondering, how can boards discipline members without access to the report cards? And does that need to be changed?
If the system we have needs improvements to give them accurate, real-time information, that's where our emphasis needs to be.
However, the Arkansas Department of Health told me they are, quote, able to communicate some concerns about provider prescribing outside of the report cards. Last year, in parts of Arkansas, there were 185 prescriptions per 100 people. That's enough for each person to have their own bottle of pills.
Arkansas Medical Board has recently come out with a 20-hour requirement, but only 1 hour for prescribing education when it does to opioids. In my personal view, that needs to be increased, especially in the midst of the epidemic that we have.
What we're having to deal with is a generation that has done it this way for years, and change is hard. But when you're number 2 in the nation or close to the top as far as being recognized as a state that has the biggest problem with the opioids, I think that demands change, and individuals have to come around.
Hammer says if the boards don't begin disciplining members and there isn't 100% buy-in, he's not opposed to taking the issue before the legislature so they can determine a proper punishment.
Make an example of you and everybody else is going to get the message.